Today we are going to discuss the value of rest in myocardial infarction, or why the patient with myocardial infarction or acute coronary occlusion should rest more so that the process of recovery will increase. Now, to increase the recovery process, what is the value of rest in patients with myocardial infarction? In our last lecture, we discussed the stages of recovery in infarcted area. What are the different stages of recovery in infarcted area? And we discussed that basically the recovery in myocardial infarction depends on whether the infarcted area is small or large, and if there is any dead fibers or not. So we discussed that if the area of the infarction is small, there will be no dead tissue as have been shown here, and if the infarcted area is large, then there will be some dead tissue which will not be basically receiving blood, and they will completely die. And after some times and some days or weeks and months, the dead area may be converted into fibrous area, and then fibrous tissue will develop, and due to contraction that fibrous area may also decrease. Another important thing is that the remaining normal cardiac muscles, it will hypertrophy or increase in size to recover, to compensate for the lost area, to compensate or to do the work of the lost area. Now today we are going to discuss the value of rest in recovery. Rest in recovery, or the value or the importance, or why the patient should rest. Now, one very important stage in the recovery of infarcted area is development of coronary vessel, collateral coronary vessel. Suppose, for example, this vessel was basically supplying blood to this area. This coronary vessel was supplying blood to the area, and it has been blocked. Now, the recovery process basically depends on how big the infarcted area is, or how big the damaged area is. And another important thing is that how much workload is there on the heart. So, area or size of infarction or damage, and workload. Now these two things determine the recovery process. If the area that has been damaged is large and the workload on the heart is high, then the recovery will be slow. But if the workload of the heart is decreased, which is basically our aim in the rest, if the workload is decreased, then the recovery will be fast. Now, how the rest is going to decrease the workload, and how decreasing the workload is going to fasten the recovery of the infarcted area. Basically, once a blood vessel, the coronary blood vessel, has been occluded, myocardial infarction has occurred, then what happens is this area starts receiving blood from other normal blood vessels. Now, for example, this is the right coronary vessel, and this is the left coronary vessel, and this right coronary vessel has been occluded, but after a few days or after some time, this area, it will start receiving blood through the anastomosis or the collateral blood vessels. Collateral vessels are basically communication between two different vessels. So basically this collateral vessel is a communication between the left coronary vessel and the right coronary vessel. Now the right coronary was basically supplying this area, and the right coronary has been occluded. So the left coronary, the blood from the left coronary is trying to basically compensate for the occlusion of this right coronary vessel. Now, if the patient is not resting, and is doing exercise, or is doing some exertion, then the workload of the heart will increase. The workload of the heart will increase, and what will happen is that these coronary vessels will dilate. These coronary vessels will dilate because the area to which this main vessel, this normal vessel is supplying, that area is also needing more blood flow due to increased workload which has been due to the exercise or due to some exertion. So this blood vessel will dilate, and the blood in this vessel, it will go to the normal areas. The blood in this vessel, it will go to the normal areas, and this condition is labeled as coronary steal syndrome. Coronary steal syndrome, because due to exertion or due to exercise, the workload of the heart has increased, and the collateral blood vessel, the collateral blood flow which was coming through the collateral vessel to the damaged area, that collateral blood flow has decreased because due to exertion, due to exercise, the main blood vessel which was responsible for supplying blood to its normal area, the demand of that area has also increased. So the blood has diverted to those areas, and instead of the collateral blood coming to the damaged area, it is diverted to the normal area because of the high workload, and it basically decreases or slow down the recovery process. And this condition is known as coronary steal syndrome, because this vessel is stealing the blood of this collateral vessels. So it is basically considered as a coronary steal syndrome, and that's why patients with myocardial infarction are advised to rest more. When they rest more, the workload of the heart is decreased. The workload of the heart is decreased. When the workload of the heart is decreased, the body is basically not needing any extra blood, any extra nutrients. So the heart rate, the contraction process, the force of contraction basically decreases. So the supply of blood, the demand of blood for the normal vessel, normal muscles, the normal muscles which are normal, which have been not damaged, the demand of that areas basically decreases. So the chances of blood coming to these collateral vessels, collateral circulation to the damaged area are more, and the chances of recovery are high, or recovery process basically is fast. So that's why patients with myocardial infarction are always encouraged to remain in bed and rest, because with the rest their workload will decrease, the heart will not be contracting more, the heart rate will decrease, the pumping power of the heart will decrease, the demand of the normal heart muscle will decrease, and the blood in the remaining normal coronary vessels will start going toward the damaged area, and the recovery of the damaged area will be fast. So that's all about the value of rest in myocardial infarction.